Hi there, I'm Dr. David Jack. I'm a cosmetic doctor. I have a skincare brand and a clinic in London. The first question I've been asked is, what is the number one top product that you should have in your skincare regime? And for me, this is definitely an SPF. So SPF is the most important thing because UV light is the number one cause of skin aging. So protecting against UV light is the most important thing when it comes to preventing skin thinning, skin sagging, and also things like age spots and the very worst cases, things like melanoma. The next question is about, is there a stigma behind getting anti-aging treatments? I would say there's not really anymore. People nowadays tend to think of injectables as just a kind of extension of their skincare regime. And there are more and more people doing these. And with Botox in particular, it's been around for about 30 years. So it has a very good safety record. The problem is that a lot of untrained practitioners are doing these sort of treatments, which has cast a bit of a bad name over the whole industry. But if they're done safely and they're done properly by trained practitioners, then they're very safe, very effective procedures. The stigma that used to exist where people were quite ashamed of doing these sort of things, I think has largely gone. People sometimes worry about doing these sort of things too young, which I would tend to agree. You don't need to be doing injectable treatments from a very young age, only when they're kind of needed. So yeah, thankfully that stigma has kind of has gone a bit. Next question is, when should you start an anti-aging skincare regime? So I would say that starting with a skincare routine from sort of teenage years is a good idea, particularly when it comes to SPF, so protecting your skin against sun damage. This should be done from a very young age. Using anti-aging products like vitamin C serums and things, you can do this from sort of the teens onwards. They're never going to do any harm to the skin really, and you do get sort of a massive amount of benefit over the longer term if you're using antioxidants on the skin. So I would say teenage years, and then as you progress in the years, you can start to add in other things like retinoids and other sort of ingredients into your skincare regime that will target particular issues that you're seeing in your skin. But generally speaking, skincare should be used from a relatively young age, and always ensuring that you have a good SPF. The next question is, when should you start thinking about Botox and fillers? So there's not really a particular age that you should start to think about having Botox and fillers. I would say that I'd be more guided by the fact if there are some lines and wrinkles there when your face is at rest, it might be time to start thinking about that. And when you're starting to see some signs of volume loss, which for most people will be in kind of mid-30s, some people slightly younger than that, and other people slightly older than that. And this varies according to a number of different factors, including things like ethnicity, and also different skin types. So there's not a particular age, but I'd be more guided how the individual looks when they come to see me, whether or not it's appropriate to start these things. The major consideration with any anti-aging treatment is that when it comes to seeing a new patient, is that they're doing it for the right reasons, that they're not that there's no kind of element of body dysmorphia that's driving the process. So obviously we have to screen for this in consultations. Generally speaking, most people that I see are kind of on board with my approach to things. I like things to be done very subtly and very gently, and not overusing any products to avoid this kind of weird look that you sometimes see with aesthetic treatments. The next question is, what are the main anti-aging myths? So I think that when it comes to myths around anti-aging, I think people sometimes feel that with Botox and fillers that they're going to look a bit weird with these, and it's become this kind of like there has become this stigma around about Botox and fillers that you're going to look a bit weird after doing them for a while. This thankfully is not the case nowadays, and with kind of modern techniques and a kind of safe dosing approach to Botox and in the way that we do fillers, this kind of weird overdone plastic look is really a thing of the past. So yeah, I would say again, always go to somebody who knows what they're doing, who's well trained, who is a medical practitioner ideally, and you should be absolutely fine. Botox should always be done so that you're not completely paralysing the muscles so you can still move them, and fillers should never be done to kind of create structures that wouldn't naturally have been there in someone's face because it'll always look weird. Doctors should never try to play God. So I hope this video has been useful, and please don't hesitate to donate to this this great cause to support the NHS. And if you have any questions for me, please don't hesitate to ask in the comments, or you can follow me on Instagram at Dr. David Jack Clinic and at Dr. David Jack for my skincare.